Dr. Najy Masri who is the LSU Director of Hospital Services at Oschner Medical Center, was with us last week and wanted to bring him back because it was real clear. It was an easy to understand segment about what's going on with COVID-19 around our state and how you can possibly prevent it, how you can be on the lookout for testing. So we invited him back. Doc, good morning. How are you, man?
Good morning, guys.
It's good to have you back. Since then, since last week, we've seen a numbers spike in the state. What do you contribute to that, and how can Louisiana try to stay in front of the curve?
Yeah, 2 weeks ago we had our first case, actually exactly 2 weeks ago today, and it seems like it's jumped. We went in 1 week to 91 cases, and then that second week we've jumped to 837 cases. We now got 20 deaths. We're in 36 parishes. There's a huge cluster here in the Orleans-Jefferson Parish area. If you remember a couple of weeks ago, actually 4 weeks ago, we had Mardi Gras. And if you could pick one thing out there that's probably the opposite of social distancing, it's probably Mardi Gras. So that's probably led to a lot of what we're seeing here locally.
Is that what you contribute? The biggest spike is just the amount of people that were in one place? Because when people see Louisiana as, when you look at the rate being third in the world, I mean, that is a number that just throws you back. But is that the biggest contributing factor, Mardi Gras?
We have numbers that rival states that have 10 times the population of us. We're talking about New York and California and Seattle, Washington, areas like that. And it was the perfect storm. Coronavirus entered our nation and locally here in our state probably right around the time that we set us up for Mardi Gras. And so that closeness, that polar opposite of social distancing, has probably led where we're at now.
Talking to Dr. Najy Masri, Director of Hospitalist Services at Oschner Medical, LSU Director of Hospitalist Services at Oschner Medical Center. So then that is wild, Doc. You see like the per capita rates in that Louisiana, we're number one in the world. I think it might be top three now. Is it too late? Like how do you think that social distancing, will that be enough to effectively flatten the curve? And then do you have any insight as to what the current how stressed the current healthcare infrastructure is right now?
I think moving forward, the numbers are actually going to stagger people. Look, we're just getting started. We're in the mid first quarter and we're down double digits. We got to come up with a game plan to win this thing, and that includes more testing. We need more readily available testing. The tests that we get back, we need to get them back sooner. Going through the state sometimes it's taking up to a week to get results of the test. That's like getting recurrent delay game penalties. You got to get something and get it back out there. But the numbers actually aren't a bad thing. The numbers initially is just identifying people who are already out there and are infected and getting them to self-quarantine, self-isolate, so you don't spread this infection anymore. So we got testing centers now here locally, the parking lots of Mahalia Jackson Theater, UNO Lakefront Arena, Alexandria at Baton Rouge, both have hospital systems that are setting up COVID centers. Oshner's been great about setting up COVID centers throughout the area. And the best lately is that Oshner's now come up with the technology to do in-house COVID testing, so the turnaround time will be much quicker.
And so that was going to be my question, Doc. What are some of the hurdles to getting that more widespread testing? Is it purely technological at this point? Is it more resource oriented?
I think it's just like our healthcare infrastructure. It's just the numbers are overwhelming us, and it's just more people. Ideally, we would test everybody. And if I could say one thing out there, if everyone here locally, everyone here in our state would act as if they had the virus, and practice social distancing and stay away from each other and avoid large gatherings and stay mainly at home unless absolutely necessary, that would put a big dent into the numbers that we're seeing moving forward.
When you say social distancing and practicing that, I've now started to kind of feel guilty when I make my way to a CVS or a grocery store. Is that the stuff that you're talking about, just staying in at all times?
Those type of things are essential. I think you just need to limit those kind of trips.
Yeah.
And when you do that, you need to go maybe like we talked about last week, go alone. Don't have to go with other people in your family. Don't have to go repeatedly. I know there's this scare out there where everyone wants to stock up. Well, stock up and stay at home and use the supplies.
Yeah.
I don't see anywhere where our groceries and our essential services are going to close down. Those will always be there. But yes, every time you go out, you put yourself at risk and potentially others at risk.
And
what we have to do is really stay away from each other and stay at home and try to curb this quickly.
So whenever I do make one of those trips, Doc, I've been immediately stripping down when I get home and changing into like clean clothes at the house. Is that if you're trying to go above and beyond, like is that a best practice there? Is that effective, or am I just doing that for nothing?
No, I think that's a good idea. I would also encourage people, if they have it, to keep wipes in the car.
Mm-hmm.
Use the wipes as soon as they get back into the car. Try to avoid touching things as much as possible. Now, one thing that's really interesting about this virus, just for the public, is it lasts in the air about 3 hours, but it actually lasts on surfaces. It can last up to 24 hours on cardboard. It can last up to 72 hours on plastic, 72 hours on stainless steel. So as soon as you can get back in your car, if you have wipes, I would use those. When you get home, I would wash your hands completely. The clothes certainly is not a bad idea, but the main thing I think is to be very sanitary with your hands.
And something else I've been doing whenever packages arrive, you mentioned the 24 hours on cardboard. I've been spraying them down with Lysol. Does that like take care of it immediately, or should I leave packages out for a day? What's the best practice there?
The main thing is whatever you're using needs to either have bleach or 60% content alcohol. So for those of us that order from Amazon, like myself, probably the best thing I would recommend is take gloves, open your package outside. Don't even bring the cardboard into the house. And then when you come into the house, take off your gloves and then wash your hands and leave the cardboard outside in the garbage.
What was your reaction to the governor's press conference on Sunday?
I think it's a start. This is something that I've been pushing for a while. We're the 9th state now to issue a stay-at-home order. It starts tonight at 5 o'clock. Again, essential services are excluded. If you got to go to the grocery, the bank, the pharmacy, your clinic, hospital, your job, and those are. It's not going to be police, but we're really imploring the public to follow this social distancing, avoid gatherings of 10 or more, stay 6 feet away from each other. Look, as sports fans, we've always wanted to impact the game, and this is our way to impact the result of the game. The community can make a big difference in this.
How much did the awareness pick up when Sean Payton announced that he was positive?
I think it brought it to home for people because that was a recognizable face to see that anybody can get it. And the scary part about it all was he really didn't have a lot of the classic symptoms. And that goes along with what we're talking about. The people that have fever and cough, I think, are more aware that they have to isolate. But he was just really feeling vague and lethargic. He wasn't really feeling to the point of the typical symptoms of coronavirus. And that's the danger of this. And again, we just have to all act as if we have it and try to socially distance ourselves so we can really stem the tide here.
Talking to Dr. Najy Masri here on Off the Bench, LSU Director of Hospitalist Services at Oschner Medical Center. Doc, earlier in the interview, you said it's like we're down double digits in the first quarter. We got to figure out a way out of this. Well, guess who was down double digits early on in the national championship? LSU at Clemson, 17-7. Joey Burrow found a way. I don't know what you did this weekend.
Call him, bring him back.
Yeah, I know, right? I watched part of the replay of that game this weekend. Do you have a favorite memory from that national championship game?
Absolutely. I was there in the stands watching them. And my biggest thing was really that last touchdown that he threw to Jamar Chase. That was one where it kind of clinched it for us. I was really excited that night.
Doc, we always appreciate your insight. The information on this Monday has been fantastic, and we'll look forward to having you back next week.
Thanks a lot, guys.
There he is, Dr. Najy Masri, checking in from LSU Director of Hospitalist Services at Oschner Medical Center each Monday here on OTB, giving us an update there.